Thank you very much, Saki.
Yeah. So moving ahead, Nigeria has now overtaken Sudan to become the country with the highest number of malnourished children in Africa. This is according to the latest data released by UNICEF, which paints a dire picture of the region's worsening health crisis. AIT's health correspondent Ogom Ezedingbo has more in this report.
In Nigeria, millions of children wake up each day without the nourishment their bodies desperately need. Malnutrition goes beyond the absence of food. It is the lack of essential nutrients required for healthy growth and development. According to the latest data from UNICEF, Nigeria has now surpassed Sudan to become the country with the highest number of malnourished children on the continent. The malnutrition crisis is more severe in Nigeria's northwestern and northeastern regions, where ongoing insecurity, poverty, and displacement have left families struggling to feed their children. UNICEF projects that millions of children in these regions will suffer from acute malnutrition through 2025, raising concerns about long-term impacts on health, education, and economic productivity. What is needed is urgent interventions, which includes improved access to healthcare, nutrition education, and social protection. These are critical to reversing the trend. Ogom Ezedingbo, AIT News, Abuja.
And with me live in the studio to take a deeper look at the malnutrition crisis in Nigeria, according to UNICEF, latest data is Mrs. Lillian Okafo. She is a senior communication officer with civil society scaling up nutrition in Nigeria. Thanks for joining us on the AIT Report.
Thank you so very much for having us.
Now, what is your take on Nigeria displacing Sudan as having the highest rate of malnourished children?
Thank you so very much for that question. So basically, globally, we know that there have been concerns around the rising prevalence of malnutrition in Nigeria. But as an alliance, we would want to base our discussions this morning around nationally available data, talking about the National Demographic Health Survey 2023-2024, which places the rate of stunted children at 40%. What that means is that where you have 10 children, on the streets, 4 of those children are stunted. We would want to acknowledge that, of course, as a result of what we've seen with this data, we can rightly establish that there's been a rise in the prevalence of malnutrition in Nigeria, because if you look at the NDHS 2018, the prevalence of stunting was at 37%.
Okay, there's been a rise.
Yes.
Does that place us as number one? Do you agree with that?
So, like I mentioned earlier, we would want to base our discussions around what we have on the NDHS. Okay. So, of course, the prevalence of malnutrition in Nigeria is high, and we believe that with the right mechanisms, with the right interventions, we would be able to move towards the direction of ensuring that, we bring down the statistics and, move towards ensuring that every child in Nigeria and that the citizenry are malnutrition-free. Thank you.
Okay, can you help us understand the difference between acute and chronic malnutrition, and which is more prevalent in Nigeria at the moment?
Okay, so basically there are various forms of malnutrition, stunting, wasting, underweight. So, but acute malnutrition and chronic malnutrition are forms of malnutrition. But acute malnutrition basically has to do with the condition that sees a child, coming down with malnutrition, as a result of not having the adequate intakes of, food in the right quantity and quality that the body requires for optimal functioning. So it's like a short-term impact of malnutrition, and it manifests in forms as wasting, bone wasting, the conditions where a child is too thin, okay, for their age. But chronic malnutrition is one that has it's like a prolonged impact of malnutrition, and it manifests as stunting. So when you say it is chronic, it is a condition that has stayed over time, and when it results into stunting, what that means is that it becomes irreversible. And stunting in the sense that, the child's IQ, is underdeveloped, and the implications are that the child is not able to do well in school, the child does not have optimal performance in school, the child might not be able to contribute effectively effectively to the country's workforce. The child might not come out with good grades in school and will not be able to contribute effectively to the country's gross domestic products.
I think that has brought me to the effects of malnutrition on children, both physically and mentally.
Okay.
Right?
Yeah.
Okay, now what are the immediate and long-term interventions that are needed to reverse this trend?
Okay, so in CS-SUNN, we preach preventive. Of course, we all know that prevention is better than cure. So there are preventive measures that Nigeria must adopt and run with if we're to win the fight against malnutrition. And one of those preventive measures, is ensuring optimal infant and young child feeding practices. It starts with the practice of exclusive breastfeeding. It continues with ensuring, adequate complementary feeding, alongside breastfeeding up until when the child, is 2 years of life. We're also looking at, maternal interventions that would enable the mother, to breastfeed the child exclusively. Like the approval of 6 months paid maternity leave is very, very key, for us as a country to get preventive measures right. Then also the scale-up of multiple micronutrient supplements, to ensure that during pregnancy, that the mother gets all the nutrients that is required, to ensure that this child develops and grows optimally before the child is birthed. And then, of course, we have other interventions around ensuring that, we have approvals for nutrition fundings, ensuring that we scale up community interventions, ensuring that, the issues around food and nutrition insecurity are adequately addressed. So there are lots of community interventions that we can scale up as a country. Improve nutrition education. How do these mothers learn how to combine the locally available foods to ensure that their families get adequate nutrition? The concept of home gardening, backyard gardening, having those gardens where you have, lots of, and we also tell people that for the seasonal periods, that we are at, ensure that you take advantage of it. The rains are here. There are lots of fruits and vegetables, that you can access, during this period. Ensure that you maximize, our various seasons to ensure that you continue to get the adequate. And above all, we are saying that the government of Nigeria needs to prioritize nutrition. We are grateful for the N774 initiative of the federal government of Nigeria, and we're hopeful that we'll get to that point, where we actually operationalize this to ensure that every local government in Nigeria has all it takes to ensure, that the communities get access to the adequate nutrition that they deserve.
Thank you very much, Mrs. Lillian Okafor, for joining us on the IT Report. And when you talk about home gardening, the wife of the president comes to mind.
Yeah, great, interesting.
Yes.
Yeah, she
Thanks
does.
for joining us.
Thank you so very much for having us. Yeah.